Pilates is just for women. Pilates is just stretching. Pilates is just like yoga. Do Pilates get a six-pack look like this?
Today, I'm joined by Tracy Ward, physiotherapist, educator, and author of The Science of Pilates.
I can't think of anyone off the top of my head that shouldn't do it.
What other medical benefits do we find with Pilates that might surprise us?
So many.
We talk about where Pilates came from and what the science actually shows for back pain, strength, and longevity.
Doing Pilates when you're pregnant can actually reduce the effects of urinary incontinence by up to 50%. So Pilates, it won't hit these levels of cardiovascular health.
I think it's a trap and it's a risk for women.
When we come near perimenopause, menopause, our bone density, it has to start now.
How many times a week do I need to be doing my Reformer class?
Okay, so I suppose if we put it on the line.
Hello everyone and welcome back to Vision of Health, the podcast where I talk to qualified experts about what being healthy really looks like in everyday life and how your daily habits can help you feel well today whilst also protecting your long-term health. I'm Dr. Frankie, I'm a medical doctor specialising in cancer research, and my mission is to bridge the gap between the science and real life, helping you make sense of the evidence in a realistic and sustainable way without falling victim to trends and fads. So whether we're talking about nutrition, sleep, gut health, movement, mental health, or longevity, this podcast is here to help you build your vision of health. I'm Dr. Frankie, and this is my Vision of Health. Pilates has absolutely taken over our feeds. Reformer studios are opening on every corner, and it's often sold as the smarter, softer alternative to the gym. Great for your core, posture, your hormones, and even your nervous system. But with so much hype, it's hard to know what Pilates actually does for our health, and is it enough on its own? How does it stack up against cardio or traditional weight training when we zoom out and look at the long-term health benefits like bone density, metabolic health, and long-term disease risk? Today, I'm joined by Tracy Ward, physiotherapist, educator, and author of The Science of Pilates. Tracy has a master's in physiotherapy and over 15 years experience as a Pilates instructor, and she brings a real refreshing and evidence-based perspective to a space that is often driven by trends and aesthetics. We talk about where Pilates came from and what the science actually shows for back pain, strength, and longevity. Whether you're a Pilates girly or a weights-only person, this episode will help you figure out where Pilates fits in your long-term health plan and where it doesn't. Tracy Ward, welcome to Vision of Health.
Thank you so much for having me.
Thank you for coming all the way down from Scotland to speak to me today. I'm super grateful. And I know that everyone, including myself, is really going to benefit from all of your Pilates and physiotherapy knowledge. For anyone who's newer to Pilates, can you tell me where Pilates actually came from and how it's evolved to what we see in studios or on social media today?
Yeah, so it has evolved a lot. And I think that's where people maybe get a bit confused or they're not so clear about where it's come from. So it was Joseph Pilates, that's where the name comes from. So he created his method. It started back in World War I. So he was originally from Germany and he moved to England just before the war and worked in a hospital. And he was seeing patients not doing very well, not recovering very well. So he created an exercise regime, which later became Pilates, to help them recover. And then after the war, he moved to America. So in 1926, he moved to New York and he set up his Pilates studio. His method, he called it contrology. So it was control of movement. And as he was building his studio, the dancers and the elite and the athletic would come to his studio and they were recovering from injuries just like his patients had. So his method then evolved and it became this original 34 exercises that he wanted you to perform in a really strict sequence, a specific dosage, and he would take you from exercise 1 through to 34. And that was contrology. That's how it worked. And it evolved across the country. His reputation got so well known. And then over time, people caught on to Pilates and they realised how beneficial it was. And people started modifying it because they thought, well, you needed a level of strength and flexibility that these dancers and elite had. And his original exercises are really difficult. They're really challenging on the body. So various Pilates schools broke it down, create variations, and they modified it. And that's what we now see across a lot of studios, is this sort of modern contemporary Pilates method.
And sometimes I see some crazy moves where I think, that cannot be safe.
Yeah.
Like where you're like suspended from the straps and things like that.
So yes, I think that's where a lot of the modifications came in, that some people, I mean, the classical repertoire is still used and it is still beneficial. I think it's getting the right method for your body and your fitness and your ability now.
And is it regulated at all? Like, do you have to do a special qualification to be a Pilates instructor as opposed to being a regular fitness instructor?
So technically, no. So Joseph Pilates never trademarked Pilates. He wanted everybody to share the joy of it and the benefits of it. So it's not trademarked. However, now, with all the legislation we have within gyms and studios, I don't think a gym or a studio would take you without a qualification.
Okay.
So yes, it would be better to do a reputable course and have that qualification.
Absolutely. And I think Pilates, I've really seen it explode in popularity over recent years, especially reformer classes. That's something I do now and never did, 5-10 years ago. As a physio and author of Science of Pilates, what are the biggest myths you see about what Pilates can do and can't do?
Oh, so many with this. And I know we're going to get onto these a little bit later on today. But a lot of the things we hear is that Pilates is just for women. Pilates is just stretching. Pilates is just like yoga. Pilates can't make you strong. And these are all things that I'm really excited for us to demyth later on today as well.
Your book, Science of Pilates, has brought such a thoughtful and evidence-based perspective. What inspired you to explore Pilates through that scientific lens, and what gap were you hoping to fill with the book?
Yes, so physiotherapist by background is where I started with things, and very soon, almost immediately after I finished my master's, I did my Pilates training, because I could see the benefit that patients would have, all my sort of musculoskeletal, spinal patients would have with the benefit of Pilates. So I did my training almost instantly and then used it both clinically and within studios. And through that, there was just so many gaps I felt that people didn't have the knowledge. Like what you're saying, people don't really know where it's come from, what it does, the science behind it all. And coming from a science background, I really wanted something that would bring that all in one comprehensive resource. And then I also started working on presenting teacher training courses, so teaching the courses that Pilates students would do to become qualified. And on those courses, again, the same questions would come up. Students would be asking, trying to understand the anatomy when they've never done it before, trying to understand how they can apply this when somebody's got an injury. And I just kept thinking there's got to be something out there that can provide people with all these answers, and there wasn't. So Science of Pilates came about.
Amazing. I'm such a nerd. Whenever I get into something, I like to learn so much about it. So it's nice to just get some knowledge about, what movements help with what and why certain exercises are designed the way they are. Clinically, Pilates is often known for helping people with lower back pain. What does the science actually say about Pilates and back pain and chronic pain more broadly?
So yes, I think back pain is the most common sort of injury type you could say that Pilates is most known for. And
known for helping or known for causing?
Known for helping back pain, yes. So I suppose if we look at back pain itself, acute back pain, if you have an episode of back pain, within 24 hours of that, there is actually changes to the muscle fibre composition and the thickness of our core muscles. So really quickly, really early on. And when we lose that local core support to our spine, we don't have that stability. So people get fear avoidance because it hurts when they move. And then your global, sort of more superficial muscles have to kick in to compensate for what the local core muscles are not doing. So what Pilates does, and all the research now backs this up, which is amazing, is that it works those deep core muscles. It gets right to them, it stabilizes them, it strengthens them. And even within 8 weeks, we can see changes in back pain. And that's because we know that Pilates, when we do the core exercises with the Pilates principles, with the breath work, it actually changes the muscle composition of our transverse abdominis, our main core muscle, and increases the thickness of it, the contractibility of it, and it helps support that back. And then it helps people move as well. So when they've got that fear avoidance of being in so much pain, Pilates helps them with a graded response so they can progress their movements gradually, slowly, and let them see that movement is safe and that movement is okay for their backs to do as well.
And so important, because often when we see people that have chronic pain, there is that instinct to not move.
Yes.
It's like when I treat people with cancer, their instinct is to stay home and lay in bed. And actually, often when you have pain, movement helps rather than hinders. And I find myself saying to patients who have pain, take some pain relief and still exercise, because there's so many benefits to exercise. And like you said, it can actually help. Whereas our thought process is that if it hurts, it's making things worse.
Yes. And then they get stuck in this loop that because it hurts, they don't move. So the local muscles decondition even further. The global muscles kick in even more. And then they end up with tight muscles, stiffness. So then they can't move. They lose that mobility. So again, the integral part of Pilates, it's not just the strengthening, it's the mobilizing, the flexibility as well. So when you bring all that together with patients with back pain, it can do so much for them. And then the research supports that, which is great.
One thing I think is really important, a lot of people's motivation to exercise is driven by aesthetics. And, if you look at the cover of any fitness magazine, everyone on the cover's got a six-pack. That doesn't necessarily translate into core strength. So you can still be making positive improvements to your core strength that's going to protect you later in life and in every day, whether that's, walking about all day, carrying a baby, lifting children, when you get older, needing to reach for something out of the top shelf. That core strength is so important for that. And that is happening regardless of your body fat telling you whether your abs are visible or not.
Yeah, 100%. I think there is that misconception that do Pilates, get a six-pack, look like this. But there is a lot more to it as well. But yes, that long term, it's doing so much for you that I think people just don't realise the full extent of the benefits of it.
Absolutely. And we are just conditioned to want to see quick benefits. And I think for me, Pilates there's little things I've noticed. Like I do a lot of HIIT exercises. F45 is my kind of go-to. And I found that in certain exercises, I used to have little niggles. Maybe, when you are laid on the mat and you do like bicycle crunches, I would feel it really in my hips. And that would be my limiting factor to whether I needed to take a pause and a breather or not. And now I've been doing Pilates for about a year regularly. I find that I can do exercises like that without any problems. Whereas that's quite a niche thing to have noticed the benefit of. I wouldn't say that my body has drastically changed, but there are definitely things like supportive that have been improving.
I think that's exactly the word. It's supportive. It supports your joints through other forms of exercise as well. So whatever exercise you enjoy, it doesn't matter. If you're only maybe doing that one format or that one type of movement, your joints need that extra support with things. And yeah, that's a really good observation to have made about the hips feeling it. So the core is then helping support your body.
Absolutely. What other medical benefits do we find with Pilates that might surprise us?
So many. Where do we start? Let's try and pick a few that are maybe well known for. So post-surgical rehab, I'll start with just being a physio. It's what I would use it for a lot. Any kind of surgical patients can benefit from it. But more importantly, if we think of maybe like lower limb injuries, so hip fractures, knee ligament problems, ankle fractures or ankle sprains, when even the injury or if they have surgery and they're told they can't weight bear, and you would think, well, I just have to sit on the sofa for 3 to 6 weeks or however long their surgeon has advised them to. But with Pilates, we can give that graded response. We can build up the muscles, especially on the Reformer, where we can modify the springs. So we can still be loading them within that safe zones that their surgeon has maybe set. And you can still be doing all that groundwork when otherwise they would have maybe just sat down for 6 weeks and deconditioned so much in that time. So that's a really great one. If we look at blood pressure, which is maybe a niche one to go to. When we do our Pilates, the breath work, the mindfulness, the sort of calming of our nervous system, research does show that Pilates lowers our blood pressure. A 1 hour Pilates session can lower your blood pressure by 5 to 8 millimoles of mercury within 1 hour, which is quite significant, quite acute time frame that can happen. And I'm not saying that replaces medication in any way whatsoever, but obviously if people are stressed, anxious, got high blood pressure, it's a great way for giving them that sort of calming response, that stress reduction that they might need as well.
Any other health benefits like heart health or bone density and things like that?
Absolutely. So bone density, particularly with like osteoporosis, we know it's a huge condition or a problem worldwide. And with our Pilates, it can help to load the joints. It can load them in a safe way where with osteoporosis, people might be in pain. They might be fearful from moving, scared to load because they know they've got this condition with their bones. So when we load them gently, we load them gradually, we can build up their confidence, we can improve their balance, we can reduce their fear of falling or the risk of falling as well. And people with bone density issues generally can have a huge psychological impact as well. So it can improve their confidence to move better and move well.
And I think it's actually really hard, but it is quite palatable as like an entry-level exercise. If you're someone who doesn't necessarily identify as someone who exercises, which is so important for sticking to something, or you are, in your 50s, 60s, 70s, and you've never exercised before, Pilates feels achievable.
Absolutely. Yeah.
Because 100%. It's modifiable and it's not super intense. But there are so many benefits. And when we talk about these things like blood pressure and osteoporosis, it's really easy to think it doesn't matter now. Like the demographic of people listening to this are probably women in their 20s, 30s, 40s. It does matter now because the foundations that we lay now for our health make an impact for the long term. Preventing osteoporosis doesn't work when you're 60 and you've got osteoporosis.
Yeah.
Your prevention starts now, and our estrogen levels are declining year on year from around age 30. So it is something to think about now. It's just not the sexy and attractive thing that we think of when we think of Pilates. We think of that snatched Pilates girl body with a matcha in hand, and it's so much deeper than that. I think one reason Pilates has really blown up is that many women now are really wary of spiking their cortisol or overstressing their body, and Pilates feels like a gentler option. Do you see that as a positive reframe, or is there a risk that women may be missing out on the benefits of heavier strength work or higher intensity exercises and cardio?
So just exactly what we touched on there gently. Pilates is definitely the gentler approach. It does cause that stress reduction. It does reduce the stress on our bodies and within our bodies. So excellent for that. But yes, we run the risk of, as we get older, like you're saying, when we come near perimenopause, menopause, our bone density, it has to start now. So I think it's positive to frame it as that gentler option, or if you're having a really high stressed day, week, year, it's absolutely something to add into regularly to get you that stress response and reduction with it. But we absolutely also need to be doing other forms of exercise. So we need to be doing that strength training, that loading to get those muscle and bone density changes as well.
I think that's important because particularly in London, exercise classes and having a membership to a studio is so expensive that I think people think, well, if I need to go 4 or 5 times a week to get my money's worth. But actually, I think it's important to remember that there are other forms of exercise that have different benefits on our health that are complementary to each other. And sometimes doing the same thing every day actually isn't the best approach. For someone who is influenced by TikTok Pilates but is short on time, what is the minimum effective dose that still gives meaningful benefits? How many times a week do I need to be doing my Reformer class?
Okay, so I suppose if we put it on the line, really 2 to 3 times a week, you would want to be doing some Pilates. That can be at home. It doesn't have to be at your class if finance is a barrier or location is a barrier. So 2 to 3 times a week, I would say, and it needs to be 45 minutes duration to get the full benefits. Obviously, anything is better than nothing, and you'll still get even 10, 15 minutes of exercise. We get that feel-good endorphins, that stress relief, and it'll feel positive on our bodies and our energy. But to see the meaningful physical benefits of it, 2 to 3 times a week, 45-minute duration, I would say we have to go with.
Okay, good to know. A lot of women come to Pilates for that snatched, toned look. Realistically, do you think Pilates can achieve those aesthetic and body composition goals on its own, or does it need other forms of training alongside it to achieve that?
So Pilates can absolutely change how your body looks. It depends what you're after. If you want that really snatched, toned, aesthetic look that seems to be promoted with it, Pilates alone won't get you there. It will improve your posture, so it might make you seem taller. Everything will seem more in alignment. Waist might appear smaller if you've got better posture and you hold yourself better. So it can absolutely change from that side of things. It will tone your muscles, and over time it will improve muscle definition. So If you've been going to Pilates for, longer than sort of 3 months and you keep it up consistently, you will see muscle definition changes. But that really, if we're going into that really snatched, toned look, you do need to have both the strength training, so you do need to be lifting weights with that. And I would also say good nutrition as well. You would need to have both hand in hand with it.
So important. And I think for me, I have insight into the fact that lots of people that are now promoting Pilates, or they have an app and now Pilates is a big part of that app, often did years of weight training before, and your body doesn't just forget. So we have to remember kind of different stimuluses on our muscle fibers has different effects, and actually that load is important. Your body weight can help, but I think it's a trap and it's a risk for women to think that Pilates entirely replaces strength training.
Absolutely.
And the weight section of the gym is not just for men. It's not going to make you super bulky. I think, we could only wish that we could build muscle as quick as people fear in their head. But yeah, it's a nice addition. And I think when we go back to that stress and that cortisol spike, sometimes it's not about the one gym session. It's about what you consistently do. And if you just add a little bit of variety to your week, we've really moved away from that kind of culture 10 years ago where it was HIIT workout every day before work, get up at 6 a.m, HIIT workout, go to a whole day of work, come home. We were exhausted.
Yeah.
Whereas this is a kinder option to, slot in as an alternative a few days a week to have something calmer but still beneficial.
Absolutely. And I think the two, on other exercise forms as well, they go so hand in hand because you can have that strength training, that loading, that building muscle for that sort of body change if that's what you're looking for, or those strength gains, and then the Pilates to offset it and help with any injury prevention as well and support you through your other exercise forms.
It's so hard to fit everything in. And I have really had to let go of the idea that I'm going to be really good at one thing, because fitting in, 1 or 2 strength sessions a week, 1, 2, 3 Pilates. I also like to run. I also like to walk my dog.
Yeah.
It feels like, where do I have the time for this? And I've kind of now realized, if I do 1 or 2 runs a week, if I do 1 or 2 Pilates a week, 1 or 2 strength sessions, it's fine. It doesn't need to be this like perfectly followed program where we have to drop our entire social life or compromise our sleep quality to fit all this in. It definitely needs to be something that works for our schedule.
Yeah. And I think that's what people are, hopefully, recently I feel we're getting more into that people are appreciating. You don't need to hit the gym 5 days a week or Pilates 5 times a week or, like say, go running or HIIT every morning. I think people are now appreciating the balance more and that you can get benefits from doing different things and not just that one method.
And I think one thing there that takes us nicely onto mat Pilates, because there's lots of apps now where you can do mat Pilates at home. That might be an option for people who are a little bit more time conscious because you don't need to travel to a studio and spend time that way. When it comes to mat versus Reformer, are these just different formats of the same thing, or do they genuinely serve different purposes?
So they are both obviously very much Pilates and have the Pilates principles, but they work you differently. So they're on different apparatus. So mat, yes, convenient, accessible to everyone at home. You can literally do it anywhere with just a mat. Mat uses your body weight or maybe small equipment. So we might use the resistance circle, resistance bands, soft balls. So it might use those. But primarily it is your body weight. And I would say it's more about your core control and your precision of your movements and how you move your body through the flows. Whereas our Reformer, we've got the springs. So we've got different tensions. We can work those to our advantage. So you can make an exercise easier by changing the spring loading. You need a level of coordination and knowing your way around the Reformer as well. So I'd say Reformer would be more sort of greater strength benefits and intensity because of the versatility of the springs as well.
If you're someone probably like myself who has grown up in that toxic diet culture where we were so mean to ourselves, like we just hammered our bodies doing all these different exercises, probably not fueling properly. Sometimes I think it's really easy to think that home workouts and things like mat Pilates aren't enough. Do you agree with that? Or do you think they are doing beneficial things for our body and it is a good use of time?
I think it is a good use of time. I think they are beneficial for your body. But like we've touched on, I think it's not the only thing you should be doing. So you will get strength benefits from it. You will get muscle definition, you will get core, improved posture, improved flexibility. So all really valuable benefits to us, but we will be lacking in what other exercises or other training can bring to us as well.
Okay. But if that is something you're doing alongside, you're not wasting a workout opportunity. It is still...
Oh, absolutely not. No.
And you know what I find as well? It's really good for discipline and being honest with yourself, because I found ways to cheat some of those exercises. Like on the Reformer, the pike exercise.
Yeah.
That's not working my abs. I just throw my bum in the air and it feels easy. It's almost like a rest. And now I have to be really honest with myself. Like, no, I need to actually have proper intentions and concentration, and then it suddenly burns.
And I think it's the intention of the movement and the control of the movement, rather than just trying to get a movement done and get on to the next one. So yeah, it's that honesty with yourself. It's that discipline of making sure you've got that core engaged, you're moving where you should, you're moving with control. Because a lot of Pilates as well, I think, is that it's time under tension to get your strength benefits. Where we don't have the heavy weights that you maybe lift in the gym, which can do the job for us. Pilates, it's not about rushing through the exercises. It's about doing them slower, controlled, so that they actually get the benefits from it as well.
My Pilates instructor, Ben, he always says, so we go to quite an early class before work at 6:30 a.m. God, don't know how to get up that early. And he's always like, you didn't get out of bed at 5:30 to cheat yourself out of the benefits of this exercise. And I just hear that voice all the time when it's burning. And it's true. I think that's a really good practice for people who have short attention spans. Our minds are everywhere. We're always thinking of our to-do list, to really focus on the intention behind a movement and giving yourself the grace to do it slowly and concentrate on it. That is almost like a form of mindfulness and meditation.
Yeah, I was just about to say that is actually where the mindfulness comes from, that mind-body connection, in that you're not just there to run through the exercise. It's really thinking about how you're doing it, your breath work as well, getting the breath work to work with your movement in coordination. And that's where we get that sort of stress release from it and that feel-good buzz as well.
I think we talk a lot about the benefits of exercise when we come to things like muscle mass, bone density, heart health. We talk about that feel-good endorphin release. I think for people who struggle with a racing mind, have a lot on their brain, or maybe they have something like ADHD and there is always things going on in their brain, exercise is such an amazing tool for regulating your nervous system and clearing your mind of all those other things. Because whether you're focusing on the number of reps you need to do in a class, or how slow you're going on a Pilates move, or you're breathing during a run, you're not thinking about all the other things.
Yeah, absolutely. And I think that's the best thing. Like when I teach in the studio and you see everyone coming rushing in from work, or they've been busy with kids, or they've been delayed traveling and things, and you can just see the relief in them when then you start actually going through the class and exercising, and they get that calmness and they can't think about anything else, because they are thinking about how do I move, where do I go, where do I breathe, what's my arm and leg doing. So yeah, really nice to see that with them.
And I think for anyone listening who is someone who feels like workouts have to be really painful and savage, and that they have to sweat and it has to burn and it has to be quite an uncomfortable experience, I think this is your permission to give yourself some grace to do the slower workouts. Definitely. Because Pilates is still hard. It has so many benefits, and you're not taking a day off just because you don't break a sweat.
Yeah, absolutely. And I don't sweat when I do Pilates, but I definitely find it hard. And like I say, it's working to the right level. And I think that's where, not necessarily saying you have to do it every day, but making sure you do progress your workouts. So I wouldn't do the same Pilates exercises. Like if you're doing them at home, I wouldn't do the same thing every 2 to 3 times a week with it. You need that progression. You still need to have that overload.
Yeah.
Whether that's changing the intensity of the exercise, whether it's adding a resistance band to it, a longer hold, a longer flow, for example. So consistency is important, but I think having that progression as well.
Absolutely. Are there any risks or considerations, particularly with Reformer Pilates, that people need to know about?
Yes, I think the Reformer, we are in such a hype of it. So lots of people are trying it for the first time, and they might be really experienced in other exercise or even in Pilates itself, but not on the Reformer. So the Reformer is a moving carriage. We are exercising on something that is going to move. And I think when people want to get going and they're excited to just get on and get started, you just have to appreciate that that platform is going to move and it's going to slide depending on what springs you've got on. So there's that fear of falling off, which is a really high risk if you don't know what you're doing. The springs themselves, if the machine is not set up on the correct springs for the exercise you're doing or for your body or your ability, you can really run the risk of hurting yourself. So if you've got your arms in the straps, we could hurt our shoulders. If you've got your feet in the straps, we can hurt our hips or our knees if the tension is not where it should be. So yes, there's definitely risks involved, and you need to know what you're doing or have a teacher that knows what they're doing and can take you through that safely.
And what about if you just got bad form and you end up with an imbalance, or you are cheating yourself out the pike like I do? Is there any risks from repeating that over the long term?
I suppose you're conditioning your body not in the way that you want to with it. So as long as you are being safe, I would say risks would be lower. But yes, you're potentially putting stress. So your pike, for example, if you're not really using your core and you're just throwing your hips up into the air, it might be fine in the short term. But if you did that repetitively, depending on what position your back was in, you might actually end up straining your back because you're not using your core and maybe the position that you're in. So you could put pressure in different areas of your body that you're not meant to.
Okay, that's me going back to my core-led pike. Pilates classes are often marketed as fat burning because of the aesthetics and the trends that are associated with it. In reality, how does a Pilates session compare with something like brisk walking, running, or high-intensity interval training for cardio fitness and metabolic health?
Good question. So with our HIIT, you're looking at your high intensity, your anaerobic fitness. With any kind of cardio, whether it's a brisk walk or a jog, we're looking at that aerobic fitness and our endurance. So Pilates, it won't hit these levels of cardiovascular health. We're just not working our heart rate to a high enough level for it. We might have small sections within our Pilates class that we maybe do raise our heart rate, and we certainly can find it hard work. But I wouldn't say it raises it enough, or it doesn't sustain it at a level to cause that sort of metabolic health benefits with it. That being said, we did mention earlier that it can lower your blood pressure temporarily after a session. So I think we know that it does cause a cardiovascular effect, and it can help in that sense. So it can help more with our recovery from it, and a quicker recovery is also good. But I wouldn't say it pushes your heart rate to the levels that we want for our cardiovascular health.
I think that's a really important point, and one that I hadn't considered before, that when we are talking about heart health, we're not just talking about the actual heart muscle. We're also talking about the resistance that your heart has to pump blood to the rest of the body. And if Pilates and other forms of lower intensity work are helping with blood pressure reduction, that's going to reduce that resistance against your heart and keep your heart healthy. Blood pressure is a massive cause of heart attacks and strokes, particularly in the Western world. So I think that's something I'm going to remember, because I definitely fall into the trap of thinking, unless I'm heavily breathing and sweating, I'm not doing anything for my heart.
Yeah.
When actually we are. But I agree. I like that you keep saying it's alongside other things. What about weight loss? I think we think weight loss is such a taboo subject. No one wants to admit that they want to lose weight these days. And I think there's nothing wrong with that if that is a goal of yours, or if you're body fat percentage is posing a threat to your health. Is Pilates something that can support weight loss, or is it more helpful to think about Pilates for your strength, body composition, mobility, that kind of thing? Or does it have weight loss benefits?
I think, so like I said, it doesn't necessarily raise your heart rate to that sort of cardiovascular level that we might need to cause that metabolic change in the body. But I think what Pilates can do is it can create that sort of weight loss mindset, that you are being kind to your body, you're looking after your body, you're making it part of your routine. So usually I find when people start Pilates or add it to their routine, they then start looking at health benefits or healthier benefits across their week. So they might try to get better sleep, they might try to eat a little bit healthier, they might add an extra brisk walk or extra training. So I think Pilates really feels like a way to look after your body and be nice to it and kind to it. So I think on that basis, it can help with the weight loss. But on its own, it wouldn't help with that benefits for us. We would need to, again, add it with other things.
And of course, diet is a huge one.
Absolutely.
But I think I think because it's really hard to quantify levels of inflammation and stress in our body, it sounds like a bit of a woo-woo subject. You know, we say like, oh, I'm inflamed and that's why I'm holding belly fat. You see those viral reels all the time. I don't think it's necessarily as straightforward as that, but I do think chronic inflammation and chronic stress has knock-on negative effects for our long-term health, whether that be how much fat we store or other negative health effects. So I think it all is nuance, and all these things help each other. So if you are someone who's calm, well slept, moving their body regularly in that environment of health, I completely agree. There's things that are going to have this nice like ripple effect to get you to your goals, whether that be weight loss or other health parameters.
And then I think it's thinking about long term as well. So like say when you're maybe in your 20s, 30s, 40s, it's maybe not as relevant. But when we're looking at the sort of major morbidities that we might have, like heart attacks, strokes, a lot of them stem from high stress as well. Yes, there's a lot more to it than that. But if we can lower our stress from early on and carry that on, you know, every week, every year, if you're just generally have reduction in your stress, then that can help with sort of long-term health as well.
Yeah. I think some people get really confused of how to structure their training. We need variety. We've mentioned that, some cardio, some strength, some Pilates and rehab work. We've got busy jobs. We may have families to provide for. We've got social lives. We've got meals to cook. I think a little bit of structure is helpful. Can you tell me what a perfect week of training looks like for a woman? Give us a movement menu.
Oh, so there is actually really good research on this that supports and backs this up with what we should be doing. So in an ideal week, we should be strength training a minimum of twice a week. So lifting weights and lifting heavier weights as well. So not just lighter ones, but actually really pushing ourselves. So twice a week strength training, Pilates 2 to 3 times a week for all of the benefits we've said, your core strength, your flexibility, that stress reduction, the mindfulness, posture, alignment. And we should also have some form of cardiovascular fitness as well. So 150 minutes per week. And the guidelines state it should be sort of moderate intensity. So we should be feeling like we're pushing ourselves with that as well over the week. And that would be ideal. So a couple of times strength training, couple of times Pilates, and then some form of cardiovascular exercise.
And with anything, I always say, if you are someone who's not doing these things, start small. We've said that doing around 45 minutes of Pilates is the best, but doing 20 minutes is still going to have some benefits. And if you're someone who does no Pilates, jumping straight into 3 times a week might be a bit much. So start small, have 15-minute workout or do 1 class a week and then slowly build it up. I think that's really important. It's not like there's this threshold of benefit. There is a sliding scale, and if you do a little bit, you're still going to benefit.
And I think people might see that as a barrier. They're like, well, I don't have 45 minutes, so I just won't bother.
Yeah.
And then the weeks go by and you've still never started. So absolutely 10, 15 minutes and then get consistent with it and then progress.
I'm so guilty of this. I like running, but in my head, if I don't have time to run a 5-kilometer run, I don't bother. Where has that arbitrary value of 5K being the minimum run I can do? Like, it's still quite a long way and it might take me 25, 30 minutes. But even 15 minutes of exercise that day would still be beneficial. And I have to really like check in with myself and give myself permission to just go and do a 10, 15, 20-minute run. If that's all I've got time for that day, I'm still going to feel better.
Yeah, I think it's just pressure we put on ourselves, isn't it? That if you don't have time for an hour in the gym, a 5K run, an hour Pilates, then we just don't do it. But actually, that's where the habits come from. That if you can start with that 10, 15 minutes and do that consistently and then add a little bit more, it's going to become easier to make it part of your lifestyle than if you're searching for that hour to do it, you're never going to find that time.
And I say it to my parents all the time, and I say it to my patients all the time, do 5 minutes, do a little bit of movement, and then I don't give myself that same grace. And I think that's really important. It's like we have this ridiculous pressure on ourselves that social media doesn't help.
No.
But half of the people we're following on social media, that is their job, to create content. They have a lot more autonomy over their schedule. If you're someone who is working, you know, a 9-to-5 job and you don't have time to go for a class at 11 a.m, then do what you can.
Yeah. And it's the same with my patients, that if I'm treating for example, if somebody with back pain, I don't give them 45 minutes of Pilates to do at home. No. We give them, I might give them 3 exercises to start with, 5 exercises, because they're in pain and they can't move very well, but they will still see the benefit of it. And that's from doing 10 minutes and they do get the benefit.
I sometimes say to patients, if you're sitting watching TV all day or reading a book or whatever they're doing, get up every hour and just stand up out of your chair and sit back down 10 times, and it's to get their quads working. And they come to me and they say, I can't get out of my chair without using my hands for support. And then they keep practicing it. And then they come in and they're like, I managed to get out of my chair unassisted. And it's like, so it does work.
It does work.
It does strengthen your quads enough to not need assistance from your arms. And I think we don't allow ourselves that kind of permission that small amounts do also help. Even though Pilates works a lot on flexibility and lengthening and mobility, how should you finish a session? Does it still matter to do a cool down and a stretch?
Yes. So yes, it does integrate your stretching and your mobility through your class. But I think a cool down is really important to finalize the end of your session. Give your body that permission to relax, to know that we're finished, calm that nervous system. Because even if you've not been sweating and struggling through, you've still been doing a session. So it's still important to let that nervous system calm down, mark the end of your session. It can also capitalize on those warmer, on those flexibility gains that you've had in the class because you're warmer. So you can maybe stretch a little bit more towards the end of the class anyway and get more benefit from it. And then I think that sort of body awareness, that posture, just to send you off, I do think it's really important to conclude with your cool down.
And I think giving yourself that 5 minutes, everyone has 5 minutes to stretch.
Yeah.
And we're so silly sometimes that we go and do our workout and then we just walk straight out and go to work. It's give yourself the 5 minutes.
And I think that's what it is though. It's just that you feel you don't have time, but really that 5 minutes to calm yourself down, mark the end of your workout and the start of the rest of your day, if it's the morning, for example, is really important just to give yourself that time.
That's something I need to remember. How does Pilates need to adapt across different life stages and situations? For example, pregnancy, postnatal recovery, maybe going into menopause.
Yes, so amazing for all of these stages. So, and it can be done from pregnancy right through to giving birth to early postnatal. You can use it all the time. There's not a time that we don't use it, but there are certain things that we modify. So in pregnancy, usually after the first trimester, we would minimize flexion-based exercises, so your curl type movements, just as the bump is expanding and to take the pressure away. But we can still work the core in different ways. So we would change position. We would maybe use small pieces of equipment for it. As they get further along, we would obviously avoid prone lying, so lying on your stomach for obvious reasons. But we can move to 4-point kneeling or again onto equipment. And we also look at supine lying, so lying on your back. Guidelines have changed on this a lot very recently. So we used to say no lying on your back. Now we look at how mum is feeling, and if she's feeling any symptoms of dizziness, breathlessness, reflux, then we would want to elevate the head up or change position.
And why is it bad to lie on your back if you've got a bump?
So generally because the sort of large arteries run and we're lying on our back, we can put pressure onto the large arteries. So it can potentially reduce blood flow to either mum, and that's where they might feel dizzy, or to baby. But the risks are very low. And the research recently has said that this is safe to do so now. So we don't need to be scared of it, but we need to monitor how you're feeling. You don't want to be doing an exercise and staying in that position if you're getting a little bit short of breath or starting to feel dizzy. There's much more beneficial ways that we can move you instead. So that would be for pregnancy. There would also be more focus on pelvic floor activation when you're pregnant, because doing Pilates when you're pregnant can actually reduce the effects of urinary incontinence by up to 50% if we start it during pregnancy. That's a condition that a lot of women think that you only do it when it's too late, when you already have the problems post-birth. But if we start it in pregnancy, it can have huge benefits on it. So Pilates would encompass that quite early on.
I always think it's hilarious when you talk to people and then you realise how many people actually try and train their pelvic floor. I don't do that. Sometimes you need to start. People and they're like, I'm sat doing my pelvic floor right now. And I'm like, crap, I better start doing that.
Yes.
But I do Pilates, so I'm helping in some way.
And then as we move into sort of postnatal, I would say greater benefit or greater focus on core activation, because naturally abdominals will be much weaker at that stage. So lots of core activation, gentle, graded response with it. Lots of glutes work postnatal, because you're sat down so often, whether you're nursing a baby, feeding baby, playing with baby on the floor, you're sitting so much of the time. So glutes can weaken quite quickly. So lots of glutes focus postnatally. And then as we come into menopause later on, definitely needing more weight bearing for that bone density, that bone stimulation, and that weight bearing load through our joints and through our muscles.
And also it must be great for like coordination and balance as you get older as well.
Oh, absolutely, yes. So balance, coordination with it. And then also we spoke about muscles deteriorating as we get older, but pelvic floor muscles atrophy as well. And in menopause, it happens, it accelerates. So again, pelvic floor people think of it more when you've had a baby, but actually we should be thinking about it early on, right through to later on in life.
And the reason that pregnancy and, well, I suppose pregnancy can increase your kind of intra-abdominal pressure, and that can weaken your pelvic floor. And then obviously childbirth and vaginal deliveries can do the same. But I think we also need to remember that carrying body fat on our abdominal area can also increase abdominal pressure and weaken pelvic floors.
Yeah.
So this isn't just for people that have had children or been pregnant.
Absolutely not.
After birth, how important is it to return to movement, and where can Pilates fit in for that early postnatal process? Because short on time feels like quite a good way to get back into exercise.
Yes. So moving very early on now, we suggest, really early on from first few weeks. Obviously, it depends on the situation of your birth and how you're feeling. But yes, very early on. And we would want mums to be beginning that core muscle activation. It's really gentle, it's graded, it can be built up. And yeah, short on time, they can do 10, 15 minutes on the floor with baby. It doesn't have to be 45 minutes to an hour. It can be really short. So very early on, almost from the first few weeks, we would be wanting to start even just getting your core on and off, core engagement, pelvic floor engagement to get those muscles working.
Obviously, if anyone's had like a C-section or a complicated birth, it is good to get medical sign-off to return to exercise. But for most people, I think there's that fear of going back into exercise.
So I think if they have had a complicated birth or they've been told by their health professional, obviously that's the guidance they would follow with. But even really gentle, just activating their core, activating their pelvic floor. It doesn't have to be strenuous and loading, but it can still really benefit just to waken up those muscles again and get them active.
For mums with busy schedules, finding time to exercise can be challenging. Do you think doing Pilates is the best use of that time? Or in what scenarios might you prioritise something else?
So I'd say it's definitely a good use of time. It's always a good use of time. But I think if we're speaking about sort of new mums or busy mums that have got a lot on their schedule, it depends what they need at that time. So I think if they are needing some posture work, some core work, if they've got back pain, if they've got just a low energy day, excellent use of time to just do 10, 15 minutes of Pilates or however long they have. If it's a day where they're really exhausted, I would say no, rest. Give yourself that permission. You don't need to be go, go, go. And where you might think that you're being good to yourself by squeezing in a workout and the only time you've got, if you're exhausted, just rest. And if you really need like an energy boost, I would say a walk outside, get some fresh air, or maybe a quick sort of weight circuit to really raise that energy might be better use of your time. So I would say, yes, it can be useful, but choose what you need that day.
And choose what you enjoy, because the best form of exercise is the one that you're going to be consistent with.
Oh, definitely.
There's lots of conversation about exercise and the menstrual cycle. Is there any good evidence that Pilates can help with cycle-related symptoms?
Yes. So Pilates fits in quite nicely with this. I think a lot of people don't really know about or appreciate. So when we are in our luteal phase, where just before our menstruation, when progesterone is starting to rise, we get those symptoms of like inflammation, slower digestion, greater sort of pain or reduction in our pain response or how we cope with it, more nervous system sensitivity. So Pilates can be really good at helping with things like bloating, cramping, because it's gentle movements. It's moving our spine and our pelvis. Gentle sort of twists and hip opener exercises can be really good at getting the bowels moving, and that bowel mobility can help with that bloating symptoms that we can get as well. When we do the breathing and the mindfulness, it can relax our pelvic floor, so we can get, again, sort of reduction in that cramp feelings that we might have. And then I think just that general movement when all you really want to do is curl up and not do anything, but actually just that gentle movement can ease the cramps, ease the bloating, maybe give you a bit of an energy boost if you're feeling really fatigued and like low in mood as well. Just having some time to breathe, go through the exercises can maybe just reduce that sort of anxiety feelings we might get as well.
I think it's going back to that, if we're in pain, don't move, just sit on the sofa and curl up. But actually exercise and gentle forms of exercise are great for PMS, so premenstrual syndrome, and period cramps. So only if you want to, of course, but it's not going to harm. Is there any science behind adjusting the type or intensity of Pilates across the menstrual cycle, or is that more about individual preference? Because cycle syncing is getting its moment.
Yes, there's a lot of noise about that at the moment. And I think if you do experience symptoms and you do struggle at certain times of your cycle, there is some evidence to say that we'll actually maybe reduce it on that day or do a lower intensity session. But I think it's very individualized. It's not a case of when you're at this phase of your cycle, you should be doing this. And it's the same for Pilates. If you're feeling full of energy, make your sessions harder, higher intensity. If you're not feeling that, or if you're in that sort of PMS phases, make it a bit more gentle. So very individualized, I would say, and modify it to suit how you feel at that time.
Completely agree. It's not prescriptive. The thing I like about the cycle syncing concept is getting to know your own cycle and how you feel at different stages of your cycle and how your hormones fluctuate. I love having that awareness. But it's not prescriptive. If you wake up in your follicular phase and feel amazing, go for it.
Yeah. I think it's also giving yourself that permission sometimes, that if you are feeling like it's a rubbish day and you're thinking I should be doing that high intensity session, but you could think, well, actually this is where I am in my cycle, my body's telling me to take it a little bit easier. So you can give yourself that permission. Equally, if you feel great, you can go for it. But yeah, very individualized.
Agree. When someone's dealing with an injury, how do you approach the balance between rest, exercise modifications and regular movement?
So if they are in like severe pain or pain that is worsening or not settling, then that's when I would then say that's when we need to rest. We need to get that pain under control. Otherwise, you're just pushing into more pain with it. So severe pain or worsening, definitely we need to rest first. Maybe speak to like your doctor or get pain medication or other forms of pain control. If it's not quite at that extent and there is pain, but it's manageable or it's influenced by exercise or it's quite stable, then we would look to just modify. So in clinic, when I've got patients who most of my patients are in pain and we need to move them in some form of another, we use a very subjective scale of like out of 10. So if your pain is maybe 3, 4 out of 10, so it's maybe there, but it's not progressing, then we would continue with the exercise. And then the other marker I would use is if that pain is not settling sort of within the rest of that day. So if you felt it in the morning and you're going to bed still feeling that pain, that's a sign that that session was too intense for you and that we would want to reduce it.
For people living with ongoing pain or chronic conditions, how do you decide that boundary between doing something like Pilates and actually needing something like physio or clinical support?
So looking at their level of pain, looking at how they're feeling with things. If that pain is severe and worsening, then I would say they need some sort of input. We would look at if the pain is influenced by movement, which is usually a good indication that it's maybe like mechanical in nature. If the pain is not influenced that, it might underlie that there's something underlying that needs to be investigated. Or if they flag up, if they have any red flags. So things we look at is signs of, and as a clinician, you would look at signs of cancers or neurological issues or something that needs more tests or investigations, which could be a whole range of things. And we just want to get those ruled out before we would continue to progress with it. So that's where we'd refer them to, whether it's physio, doctor, whoever would be appropriate.
Is there anyone who absolutely should not do Pilates?
I'm going to be really bold and say, no, I don't think so. I can't think of anyone off the top of my head that shouldn't do it. I think what's important is the type of Pilates and the level of Pilates that we should do. So we touched on at the beginning, the sort of classical repertoire would not be suitable for those with back pain or injuries. Likewise, a high intensity advanced level class is not going to be suitable for everyone. They might need more beginner or physio-led Pilates. So I'd like to think that everyone can do some form of Pilates. Just the type of Pilates and the level that they're doing it at would be individualized.
Let's do a Pilates quickfire myth busting. Are you ready?
Yes.
Pilates is too gentle to build any real muscle or strength.
False, for sure.
Pilates is only for women.
I think it's marketed and targeted more for women, but absolutely not. Created by a man, there's nothing physiologically genetic specific about Pilates.
Pilates is just like yoga.
No. They're both gentle, both can be mat-based, but very different in their principles.
Pilates is just for your abs.
No. We work from our core, we move from our core, but it works the full body.
After listening to this conversation or reading your book, what do you hope people take away for their next Pilates class?
I hope people will feel empowered to add Pilates to their lifestyle for both physical and mental benefits, to know that it's clinically backed and it's got so much more benefits than what they might realise, and that consistency is better than intensity for them. Or not better, just important for them.
I love that. What is your vision of health? What does health look like for you?
Health to me is a strong, stable, resilient body that supports you through all your life stages and allows you to do what you love doing, whatever that is, that your body will support you, and a calm, regulated nervous system so that you can cope with or adapt whatever life might throw at you.
I love that. Such a great answer. Thank you so much for such a refreshing conversation.
Thanks for having me.
Thank you so much for listening to Vision of Health. I hope this episode has helped you feel a little more informed and empowered, and given you some realistic takeaways that you can apply to your own life to help you get clearer on your own vision of health. If you enjoyed this episode, I'd really appreciate it if you left a review, subscribed to the channel, and shared this episode with someone who might enjoy it too. It genuinely helps support the podcast and it allows us to keep having these conversations. And as always, thank you for being part of the Vision of Health community. I'll see you in the next episode.